Honor. You don't hear that word very much these days. Honor. I'm John Harris, and my website is semperluxmundi.org, always the light of the world. So I'm very interested in spiritual issues, in the decline of the spirit, of transcending immutable moral principles in our society and so forth. But where does honor figure in with all that? Even those who speak of God all the time don't seem to have many words left over to talk about honor. I, as a patient who has survived cancer after being told by our American medical establishment that he was going to die of prostate cancer, I have a few things I want to say about honor in that context. But I think I'll start not with the medical community, but just with some other examples. For instance, there's one that immediately struck me with some dismay this morning. I realized that I made a video yesterday in this series. I was talking about how doctors are playing politics. They appear to be taking issues on drugs that may or may not help CV-19, and they're not giving us a chance to explore those drugs experimentally to find out if they really work or not. They're just the doctors in cahoots with the media propaganda machine are shutting us up. The experts are telling us we shouldn't go down this road. So there's not going to be any sort of open discussion and exchange of ideas. And I used as an example of why the medical establishment sometimes doesn't seem all that trustworthy, the flu vaccine. It doesn't seem all that effective. And I said that recently, I'm not sure what year this was, but in California it was found that 1/2 of all those who died of flu had actually had the flu vaccine. And then as I rushed through the video, I found that I came back and said half the people who had the vaccine had died. Well, that's not the same thing. But, you know, you ought to try doing a performance like this live in front of a camera and see how many times you mess up on the little facts. But this morning it occurred to me, you know, I'm not going to go back and do the whole video. I did say it right the first time. And anybody who was at all fair-minded and had a sense of honor or a sense of decency would know what I was trying to say. But we have these fact-checking outfits that will seize upon something like that, where somebody in a live interview or a live performance like this will make one slip of the tongue, and the whole video can be rated as untrustworthy. Factual content is very dubious. And that's perfectly dishonorable, too, in my view. I think it's clear that our media, the mainstream media, have no honor at all. They know damn well that some of the things they're saying are being finessed to produce a certain response, and that they're representing that as truth, which is not true. And it's also including and especially the fact checkers. What a joke. Well, this is the world we live in now. It's a world where illusion seems to be more real than reality. We can't even get at reality through all of the virtual vapors and films that are thrust before our eyes. Now imagine, I think this is a critical, it almost makes the media role in our lives trivial. Imagine a doctor to whom you've entrusted your life. The doctor is being paid, of course, and he has self-interested reasons, a reputation and other things to do his best for you, but that's all really secondary. It should be in an honorable man. If you know that someone who desperately needs your help because you have learning and skills that person does not possess, but that person needs if that person is to survive, and you're supplying them, whatever the reason for supplying them, whether it's completely pro bono, or you're being paid for it or whatever, but still that person is trusting you. That person has put his life in your hands. And if you toy with that person as if he were some kind of lab animal, if he was some kind of a dog or a rat whose ear you're going to put on top of his head under sedation just to see how does that work out? Wonder what's going to happen when the rat has an ear up here. We don't even regard technicians who do that sort of thing to animals as functioning, respectable human beings. But for a doctor to treat a person that way is the very depth of despicable behavior. Surely that's a person without any honor at all. So the doctor has no honor, and I think we more and more find ourselves. I found myself feeling that kind of sensation as a patient. I found myself feeling dishonored by the doctor in that I was put through months. I was literally put through 4 months of having to go to the bathroom using a catheter. I had to catheter myself from March, April, May, and June before, in a foreign country, I finally got a clinic to give me what's called a TURP operation, something like transurethral resectioning of the prostate, or whatever it is. But it's a simple operation. It's done all the time. I asked the doctor, the specialist that I went to in early March, if he would just give me the TURP operation. But I was that rat who might be of interest if he had an ear on top of his head. That's what it felt like. The doctor decided that he would play with me and see if he might try various kinds of surgery out on me. So my case kept getting kicked down the road as he set up one test after another test after another test, trying to decide what would be fun or interesting for him to do. And meanwhile, I was going through this really dehumanizing misery. I couldn't even go to the damn bathroom in a natural fashion. I was being put through that. I think he disgraced himself as a human being. But it also, this is more interesting, and this is the difficult point that I'm trying to get. I felt that I was dishonoring myself by allowing myself to be duped by that doctor. Now, of course, I didn't realize at the time, maybe I should have, and that's I think that's an essential part of the feeling of dishonoring yourself. Maybe I should have. Certainly, as time wore on, as weeks wore into months, I feel like I should have realized this guy is not doing me any good. He's playing games with me. He doesn't regard me as a full-fledged human being. And that's where I kind of feel like I shamed myself. Should have gone elsewhere. But you trust somebody like that. I guess it's even like a relationship that goes bad. You look back and you just shake your head. And why did I trust that person for all those weeks, months, years? I should have seen the signs. It's that kind of trust. It's very intimate, possibly in some ways even more intimate than a relationship with a significant other, because you're entrusting this person with your very life, and the person treats you like a toy. As a patient, I need my honor. I need to feel like I'm not a lab animal that's being played with just to see what happens. Well, I'm having trouble with my technology here, but I need to wrap up anyway. The only thing that I want to say here at the end is that as an individual human being, I feel that my honor requires a respect for my will. I, as a patient, want to be viewed by my doctor as having a spirit, having a soul. I am not just this machine or this lab animal that is a phenomenon that's slightly out of whack. And that's interesting. Well, let's see if we twist this or pull that. Let's see what happens. No, I have something that's invisible and indefinable but an essential part of my humanity, and the doctor accepts that. And the doctor treats me with a regard for my will, understands that what I want has power over what's happening in the physical phenomenon. The doctor tries to work with me and enlist that will, maybe through getting me to change my diet or getting me to exercise more or just getting me to hope or getting me to be less depressed or frustrated or angry, to change my attitude. But the doctor knows that I can do that and that those invisible, incorporeal things will have an effect, maybe a major effect, on my physical being. That's my honor. That's the respect that I'm due, and that's the respect that I should claim. See, honor is something that you can't be taken away from you if you insist upon it. You can only give your honor away. Nobody can take it away from you. If a person is captured and tortured by the KGB, then he can nevertheless retain his honor, even if he's stripped naked and his private parts are being burned and whacked and other terrible things. But he's not he's not shamed or dishonored if he resists, because that will in him makes him a hero, makes him strong, whatever is done to his body. But when I surrender my body to a doctor, and his attitude toward me is kind of like the KGB agent who's torturing me, and I put up with it, then that's my problem. I have actually surrendered my honor to that person. And it's especially frustrating because in cases like this, we patients don't know that we're doing that. We feel not only angry at ourselves for betraying ourselves, but we feel angry at the doctor for leading us into a situation where we were betrayed. The doctor has betrayed us too. So it's a very uncomfortable situation, take it from me. And I gather from people that I've spoken to this past year, after all that I've been through, this is not at all an isolated condition. I'm not the only one who's feeling these things. Not at all. It's really kind of an outrage, I think, that our medical system produces so many people who have so little personal honor and acknowledge so seldom that we, their patients, also have honor as human beings.